My name is DeAnn Berry. I have worked at Henry County Medical Center since 2003. I originally started on the med-surg floor and worked my way into the critical care unit, and I assumed this role in 2014 as the director of the critical care unit. I'm also the director of cardiac rehab and the progressive care unit that we will open the end of this year. I started on the med-surg floor, like I said. I worked my way up from an LPN to an RN. I worked there for 5 years, moved into critical care, worked in critical care for 6 years, and then took a leadership role. I choose to work at Henry County because it is a home away from home for me. I'm originally from Nebraska, and when I moved down here in 2003, this was the first facility that I started working in as a nurse, and the people were so kind. They were so inviting and welcoming. Once I started working here and felt comfortable with the people, I didn't want to leave them. So there was a couple of stints in my career that I moved on to other facilities, and I have come back to Henry County twice because it's just home away from home for me. I would say the thing that I love the most is how kind everybody is and how it feels like a home environment. It doesn't feel like I'm coming to work. It feels like I am coming to a facility where I know the people, I love the people, they know me. We can have conversations about personal things, we can have conversation about professional things. We still get the job done at the end of the day, but it's a very home-like environment. Well, speaking from my experience, when I started in 2003, I was an LPN that started on the med-surg floor, and when I came in, the med-surg floor was a great area for me to start because I could see so much. When I decided to go back to school and get my RN, that's when I realized that I wanted to focus on a more detailed care of the patient, so I transferred into the critical care area, which was offered at the same facility, obviously, here at Henry County. So I was able to grow. There was more services available where I could continue my career here but grow my knowledge. I think it's a great starting off point. I think we offer a lot of services that you could start a really sturdy foundation here at Henry County. If you start on the med-surg floor, you will see a wide variety of things from your medical patients to post-operative patients to orthopedic patients. We also offer pediatric services on one of our med-surg floors. I do believe that this is a great place to start because we are going to continue to grow our services. We have recruited the full-time pulmonologist, and I know the facility is working on recruiting a cardiologist, so that we will be able to keep even more extensive cardiac patients than what we have now. I would say that if you are a new grad or even if you are a seasoned grad, we are willing to talk to and interview anybody that is willing to come to Henry County Medical Center. We are a small team-oriented facility. We offer flexible cross-training positions for our nursing staff. We really like to grow internally, so it's a great place to start and advance your career.